Perfect. All right. Well, welcome everyone. Just to introduce myself, my name is Adam Fry. I am one of the senior consultants here at VITAL WorkLife, your new employee assistance program as of not too long ago. So we're happy to connect with y'all and be able to support you as employees. And so today we're just going to run through the different resources that are available to you as a community healthcare system employee. Talk a little bit about how your family can also access these resources. And then, really just want to provide some time to answer any questions or concerns that you may have. I know any change is certainly, it can be overwhelming, but we're hoping that you all feel comfortable and want to connect with us going forward as your employee assistance providers. So a little bit about myself. I am one of the senior consultants here at VITAL WorkLife. So a lot of my time and energy is spent on making sure that everybody has what they need to be able to access our resources and ensure that everybody has as positive of an experience as possible and really gets what they need. So hopefully I'll be able to get you all the information that you need to, have you reach out to us if and when the need arises. So we'll just jump right in. So one of the things that's important to highlight about VITAL WorkLife, we've been an employee assistance program for over 20 years at this point, and a little over 12 years ago, we, along with everybody within the sort of employee benefits healthcare space, really identified that there was a significant need for dedicated solutions that are specifically geared towards helping healthcare professionals. That has only become more apparent through the course of the pandemic, the pending years that we've had, changes in the healthcare system, everything that's sort of occurred most recently has only brought this more to light for us. So we have really created a niche for ourselves supporting healthcare organizations and making sure that our resources are specifically geared towards you. And hopefully that is apparent through the work that we do, through the resources that we provide, through how we communicate with you and how we, talk about the work that we do, and that it has an impact. We want you to know that, as best we can, we understand what it is like to work in the healthcare field, the just immeasurable, sort of weight that comes with that work. We want to make sure that we're providing resources to assist you in being able to move on to the next day, to support the next patient, to turn your brain off when you go home at the end of the day, and then turn your work brain on when the next day starts. So one of the ways that we do that is we don't just focus on the workplace. We take a holistic perspective to all of the resources that we provide, all of the work that we do, and the way that that's best described is just by our wheel of well-being. So this is the way that we structure the sort of key dimensions that we look for in how we're supporting individuals and providing the resources that we provide. Whether it's, those sort of more traditional employee assistance program resources like counseling, which often support, the emotional and relational aspects of an individual's life, or, looking at providing, sort of articles and handouts about how to, embrace a spiritual approach to life struggles, or utilizing our financial or legal resource for, supporting your well-being in those areas. We really want to make sure that we're touching on all of these areas and not leaving anything sort of unaddressed. Even if it's not one resource that's able to support all 6 areas, we hope that the variety of resources that we provide can kind of create that more well-rounded approach. So this is kind of what your employee assistance program looks like, and how it sort of supports all those different aspects of the the organization as a whole, but also as folks as individuals. So we use this just again to help folks see a different way of looking at just a bunch of slides that often can be a bit overwhelming. The key thing to really call out is if you are looking for support, if you have questions about the resources that VITAL WorkLife provides, just give us a call. Really, we're happy to help explain and discuss and review what resources are available. And even if we don't directly have that exact resource that you may be looking for, we are more than happy to support you in finding those resources as well. So really, we want to be that partner in your well-being journey, and making sure that you have what you need to be your best self. So whether that is one of our sort of more core resources like our counseling or in the moment support, our different coaching options, our digital resources, all of these come together to really make sure that everybody at every level of the organization has what they need to be most effective in their role, and also most effective in their home life as well. So diving into that sort of core EAP resource that most folks think about, we have our counseling and in the moment support. So the key things to call out here: it's free, it's confidential. We don't share any identifying information about your engagement in any of the resources that we provide. And it's available not only for employees, but also for family members. And when we say family members, we cast a pretty broad brush. We're a national practice of behavioral health consulting practice. So we have counselors across the country. Even though we are based up here in Minnesota, you all are down in Kansas, we have folks across the country. So if you have a niece, a nephew, a cousin, a child, a grandparent who lives in a different state, they have access to the exact same resources that you do. If you are, a remote employee, you have access to the same resources as everybody else. We want to make sure that everybody has what they need, no matter where they are across the country. So our counseling and behavioral health support kind of fall into 2 different categories, and they're not mutually exclusive. You can always utilize both at the same time if the need arises. But the more sort of in the moment support is available on an unlimited basis. It's phone-based support, so you just give us a call and you can connect with a counselor anytime, day or night. So the examples I often give are, say you had a rough day at work, you just need to talk to somebody on the way home, it's a great time to give us a call. You have a difficult conversation with your spouse and you just need a chance to connect with a mental health professional about the sort of incident, the conversation that you had. You would be able to give us a call and connect for that issue. It is independent of any of our other resources, and again, it's available on an unlimited basis. So if you need to call and talk to somebody for 5 minutes, 10 minutes, an hour, and you're calling say once a week, that's not the end of the world for us. We're certainly going to look at more long-term support or finding some more dedicated resources in that situation. But you can utilize that unlimited counseling support as you see fit, and how to best support yourself in your situation. On the sort of, so complementary side of that, we have your face-to-face counseling resource. So this is available on a per incident basis, and you get 4 sessions per incident. So the best way to explain our per incident model is by first clarifying that there isn't a yearly limit on the number of times you can utilize your counseling resource. There isn't a lifetime limit on the number of times you can use your counseling resource. It truly is on that case-by-case per incident basis. So say you have a death in the family and you're looking for some additional support. At that time, you would have access to those 4 counseling sessions for that incident. 2 months, 3 months, 6 months down the road, you start experiencing some work-related stress. There's a change in your department. There was a shift in leadership, and you're looking for that counseling support. Again, at that time, for that incident, you would have access to 4 counseling sessions. And those are with the same counselor. So that's kind of where it differs from the unlimited in-the-moment support versus the 4-session counseling support. On the unlimited in-the-moment support, it's whichever one of our phone counselors is available. With the 4-session model, you're able to access the same counselor for all 4 of those sessions. It's also important to keep in mind, you're not stuck with that counselor either. Say we connect you with somebody and it's not a good fit. We're happy to get you connected with somebody else. We're happy to look into other options. We want to make sure that you're getting the optimal benefit out of this resource. And so we want it to be that, sort of collaborative conversation about what's right for you, what works best for you, and what's going to allow you to thrive. So that's just the sort of top to bottom overview of that counseling resource. And certainly if you have any questions, feel free to include them in the chat. So next up, we have our peer coaching. So peer coaching, this is our nurse peer coaching. So it's specifically geared towards registered nurses. This is again available on a per incident basis for up to 4 sessions. They're most often occurring over the phone, and they can, be for a variety of resources. We understand that, again, speaking to kind of our desire to make sure that we're providing resources that are geared towards healthcare professionals. We know that nurses, as being on the front lines, often, sometimes, especially, say early on in your career or during a significant, career change, it's nice to have somebody who's been there to just walk through your experience and, address those concerns that you're having that are specific to the nursing profession. So that's why we have this, very clear and dedicated resource to support registered nurses in making sure that they have that support that's most beneficial to them, and that is, as closely geared towards connecting with somebody who really you can kind of cut through all of the guesswork and the getting to know each other, because there's already that shared language and that shared understanding that already exists. So all of our peer coaches, our nurse peer coaches, are both registered nurses and coaches. So, they have years of experience in the nursing profession and also experience as a coach. Speaking of another really important coaching resource that we rolled out earlier this year, parenting's hard. I don't know if any of you know that, but it's definitely hard. If anybody tells you any different, they're probably wrong. And so we wanted to make sure that, for individuals who are willing and interested in seeking support, we had a dedicated resource to support those folks. So that is why we have our parent coaching option. This allows you to connect with our expert really in childhood development and understanding how to support children in the various growth stages that occur through childhood, and really defining what's most effective in addressing those common concerns that can arise in the parent-child relationship. The way that this process sort of works is when you give us a call, we get you connected with our parent coach's online scheduler. You're able to schedule that initial consultation with a parent coach, and then should you choose to utilize further coaching sessions with them, you can certainly do so. Or if you feel like you've gotten what you needed from that initial session, then you're able to, transition to counseling, other coaching options, additional supports, things like that, whatever the situation may be. So yeah, it's a great new resource. We're promoting it as much as we can, and hoping that folks will reach out and utilize it, because yeah, it can be really life-changing for a lot of folks, and it addresses a very significant area of concern, because we know that the past 2 years, hasn't been easy on healthcare providers. It also hasn't been easy on children, in a lot of ways. They saw, a complete shift. Their life was completely upended when there was the transition to virtual learning. So making sure that we have kind of that clear and defined resource for them was super important for us. So just to give you an example of a situation that you could utilize parent coaching in, kind of, prime that sort of understanding of different ways that you could utilize this resource. So child around 5 years old, struggling with some anxiety, there's been some angry outbursts. There's been some situations where, there's been some just presentation of aggression, whether that's towards, parents, pets, other family members, things like that. We were able to get that individual, those parents connected with our coach, who was able to really assess what the situation was, if there was any resources that could be additionally available, including say longer sessions with the coach, engaging with maybe having the parents utilize their counseling resource to work through some of their concerns, and all of the concerns going all the way up, just so that we, the thing to keep in mind is that, say you're using your counseling resource and a parenting concern comes up. Just because you're using your counseling resource doesn't mean you can't use your parenting resource. If you're using your nurse peer coaching resource, you can still use your counseling resource at the same time. They're all sort of separate. So if there's a situation where, say, you reach out, you get connected with a parent coach, but you're also, looking for some marital counseling, or, some individual counseling to work through some of your own concerns, all of those are fully supported by VITAL WorkLife, so that, we're really taking that multi-directional approach to those concerns. So rounding out, again, going back to that wheel of well-being that we utilize with our services, we have our dedicated legal and financial resources. So on the legal side of things, we have our legal advice. So say you have a question or a concern, something, just a general legal question, you can always give us a call and we can get you an answer, typically within 1 business day, regarding that concern. Focus specifically on your area. So, you're not going to talk with, a legal advisor who's going to give you advice if you're, for a different state or a different area. It's always going to be focused on, your jurisdiction, your state, and the associated laws. In addition, we have our legal consultation. So this is a free 30-minute consultation with an attorney. You give us a call, we assess the situation, we kind of see which legal realm this concern falls into, and then we get you connected with one of our attorneys who specializes in that area, for that free 30-minute consultation. Should you choose to continue on with that attorney, there's often a 25% discount to continue on with them and kind of, fulfill whatever legal concern you're looking to address. On the financial side of things, these are available. Financial consultations are available on a free and unlimited basis. So you're able to connect with a financial counselor as often as you need for budgeting, debt concerns, financial management, really whatever. It kind of runs the gambit, except for, like taxes. That's really not an area that we can support. But beyond that, if you have a financial question or if you're looking for, some further guidance or education around how to manage your finances and how to support your financial well-being, our financial counselors are happy to help. So the recommendation I always make, or the example I always throw up there, whether anybody takes it or not, is, say you really want to, dig into your monthly finances, schedule a monthly meeting with your financial counselor and walk through your monthly finances together every month. You can do that because that financial consultation is available on that unlimited basis. So in addition to that, we have, various identity theft prevention resources. So if you do have a situation where you feel your identity has been stolen, you can give us a call and we can walk you through the process of addressing those concerns. We also have a variety of resources available on our member site, which allows you to access, it could be legal or financial resources. It could be, estate planning, budgeting. It could be property management, things like that, on the legal financial side. But it also could be you have some questions about raising a family. You're looking to we have on our member site, we actually have a discount for in vitro fertilization resources through a partner provider. We have a discount program on online shopping. We have it really does just run the gambit. So I highly recommend, we'll talk a little bit more about how to access those resources, but I highly recommend utilizing them. So the first of those sort of more online resources is our mobile app. I always feel a little bit like a shill whenever I say this, but please download our app. I will tell you, just from a sanity perspective, it is so much easier when you need to call and you need to connect with somebody to just pull out your phone and click on the app than it is to go to Google, try to remember what our name is, because I know sometimes I forget, and find exactly what you're looking for. Through our app, you can, certainly connect with a variety of resources, but some of the best things that you can do is you could just go in there, you can click the tap to call button, you can send us a message, and you can, really do a lot of the things that you would normally do from if you had a wallet card or a flyer or something like that. If you are sitting close to your computer and you got your phone next to you, which wouldn't surprise me if you did, get your camera up. There's the QR code right on the screen there. It takes you straight to the information for how to download it from the App Store if you haven't done it already. And then for everyone, the username and password is exactly the same. So CHCSKS for the username, and then the password is member. There's a few things on the mobile app that you only have access to through the mobile app, which is our well-being assessments, which we get people really enjoy or appreciate the guidance that they can get from those well-being assessments. Our videos and things like that, those are best accessed in that way. And also, if you just have questions about, you want to do a little bit of digging into what resources are available, we have, program flyers. There's a specific flyer that we have called 50 Ways to Use Your EAP, which is just, again, a great way to remind yourself of all the different ways that we can help. And yeah, like I said, that tap to call and send a message is really helpful for taking the guesswork out of, the best way to reach us and connect with us. So like I alluded to earlier, we have our member site. So again, this is it's basically a portal. You can go to vitalworklife.com, and up in the top right, you'll see member login. The username and password is exactly the same as the mobile app. And you can find benefits information. If you're a manager or a supervisor, there's access to those specific resources. And then we have a variety of different, kind of like I was talking about with the different topics and things like that. There's online seminars that are updating on a monthly basis on a variety of different topics. Again, those legal financial resources, various articles. You can use the keyword search if you're just looking for a specific topic, or you can kind of go through. There's all these different areas up here: the parenting, aging, balancing, thriving, working, living, international. So it covers a variety of different areas. You can also see down here, there's our locate resources button. So if you click on that, there's a few different areas that you can find childcare resources, aging adult resources. You could do it basically just by like a zip code search and things like that. There's also like pet walkers, daycares, things like that, that you can see if there's any of those specific resources in your area as well. So that's those. So again, as sort of just a broad brush reminder, best ways to reach us. Again, the Vital Work Life app is more than helpful, just giving you kind of that information at your fingertips in that device that's always in your hand or in your pocket or in your purse. You can always just give us a call directly. You can also go to vitalworklife.com /contact us and use our contact us form, but you can also access that form through the app. Or you can log into the member site and access those resources in that way. And again, for both the member site and the mobile app, it's the exact same username and password, CHCSKS, and the password is member. So the last thing I'll leave you all with, this is something that we felt really strongly about this, and we really knew that, especially in the thick of the pandemic, there was a lot of extra stuff that we were taking home with us. We were carrying a lot more on our shoulders. We were not as able to really leave work at work and leave home at home. So one of the things that we really worked on with a lot of our healthcare organizations was figuring out how we could support employees in really taking just a moment of time to pause, give yourself the recognition that you deserve, highlight that gratitude that you have with the things that went well in a day, recognizing that, of course, not everything always goes well every day, and just continue to check in with yourself, check in with others. And as you're walking out the door at the end of your shift, really just turn your focus towards supporting your work-life balance and supporting yourself in your home life. So we just wanted to make sure that this was clearly identified, clearly out there. We had a lot of organizations that actually printed this out and put this at every exit, every employee exit, just so that everybody had this good reminder of, one, the resources that are available, give people a chance to really acknowledge what it is that they need to do when they're turning their focus away from the workday, and ensure that folks really had what they need to come back the next day and keep doing what needed to get done. So any questions?
Adam, this is Cindy. I just have a question, and I think I know the answer, but just to clarify, so in order to use any of the resources, whether it is just the 24/7 access, or scheduling an appointment because you had a death in the family and you need to use 4 sessions, or you're a nurse and you need to talk to somebody about your day. The first step is just to call that number that is on their card or on the app.
Yep.
And then when they reach somebody at Vital WorkLife, people will just tell them why they're calling, and the person's answering will get them to where they need to go. Is that correct?
Yep. So we do have on our phone number, we do have an automated attendant that we update regularly to make sure people get, connected with the appropriate resource in the most timely fashion. So I always recommend listening to the options. If maybe you're a little unsure, you can always, click the option for all resources. But if you know what you want and you know what you're looking for, it's pretty easy to figure out where you need to go. And our well-being coordinators are available as well, just to help direct people and complete that initial sort of intake process and get them where they need to go.
Okay. Does anybody else have any questions out there? If you want to type something in the chat if you don't want to speak or don't want to talk. I know that can be kind of overwhelming sometimes, but if anybody has any questions, we'll just give everybody maybe 5 minutes to give them time to think if they have questions, or even if they want to type something in. If that sounds good to you, Adam.
Yeah, for sure.
We're holding steady at 28 people still on, so we're all curious if anybody has any questions, I guess. But I don't see anybody typing anything yet, but give them a couple more minutes.
And certainly, if nobody does have any questions right now, I also know I just got off doing another overview a few minutes before jumping on with y'all. It's a lot to take in. It's a lot of information all at one time. And so certainly questions can come up after the fact and things like that. The thing that I can really leave you with, and I feel maybe I don't actually feel that bad anymore because I keep doing it, but like really the mobile app is where it's at this point. It's the best way to just, kind of always have that reminder. If your app screen is arranged alphabetically, it's always easy to find Vital WorkLife because we're all the way at the bottom. There's not much beyond V in most cases. And so and the other thing is, once you log in, you're logged in. You don't get logged out again, but hopefully it's an easy enough login to remember should you need to access it again. So I highly recommend just, I know the idea of having another app on your phone just kind of feels terrible, but it's one that's a good safety net to have, so that, should something arise, if maybe you're not the most interested in reaching out to Employee Assistance Program resources, or, you've made do with the resources that you've had available up till now, it's better to have that stuff at your fingertips if and when something does arise, than feeling even more overwhelmed if you don't have the information that you need to be able to support yourself, support a family member. That's the other side of it, is being able to just be like, hey, I have this resource through work. Do you want to give them a call? It's a great way to care for others and support others who are in your life, and all they have to do is just say that they're utilizing their benefit through your organization, through Community Health. So it's like, it's this really easy way of there isn't any sort of additional check. We're not going to cross verify which, employee they're, reaching out, through. It's just as long as they say your organization, they're good to go. No, there's no catch. If they reach out for those 4 sessions, so say they want to utilize that counseling resource, it's 4 sessions per incident. So if there is, through those 4 sessions, it's assessed that more long-term support is needed, then yes, there may be some cost towards insurance or self-pay or something along those lines. But what is offered, those 4 sessions, the legal consultation, that free 30-minute consultation, the unlimited financial consultations, the in-the-moment support, everything that we identified that did not have a cost associated with it, which the only thing that does have a cost is that discount that we referenced for legal resources. It's all free, it's all confidential, and you don't even need to know about it. All you need to do is say, hey, call this number and tell them that you're calling through my employer as the family member of an employee. And they're good to go.
Hey, I don't see any other questions. So I think we're good. I appreciate you joining us, and we just rolled this out in September. So we're going to keep
pretty fresh,
pushing things out, and hopefully people can get a lot of use out of it. So
yeah, thanks everyone for joining. Great to get in front of you all and let you know about, it's a pretty big change coming over to a different employee assistance program, but we're happy to help, and we're definitely ready for whatever it is that's kind of going on for you, going on for a member of your family, and we're here to support you.